Mr. Joe Gallia. I am one of the cardiothoracic surgeons working in this hospital. I do mostly heart surgery, but we do thoracic surgery as well. So when you have to do a kind of surgery when there are tumors in the chest wall that are eroding into ribs, you might have to resect either one or two ribs. And at the moment, what we normally do is we do a cement patch to patch the defect that arises from in the chest. These bridges, they are titanium alloy bridges, are very, very interesting because you can, as you can see here, you can apply them to the ribs at the side of the defect, bridging the defect. In that way, you are going to have two improvements from what we have. First of all, you have the same regularity of structure. There won't be any bulges or there's regularity. It is more physiological in this way. There are various sizes. I have got here 3 sizes, so you can fit to any place, and I will be very willing to use such a system because I think it will be beneficial to our patients.
In a situation where you've had to resect an area of rib, it could be multiple, like we see over here. It could just be one rib. Most commonly, it would be cancer invading the chest wall, where you have to resect part of the chest wall. It could be a very bad trauma as well, or it could be something physically actually wrong with the rib. In that case, just putting an overlying graft will not be enough because the chest generates negative pressure, so that would move in and out. So you need something stable and something steady on which you can then overlay either a flat graft or a synthetic mesh layered graft. So this proposed rib bridge is malleable, so it can take the shape of the rib. The edges can be bent to latch on to either end of the rib that's left, and that can either be screwed or allowed the freedom of movement sliding in and out, as long as this is proven to be safe, that it will not detach backwards from the ribs. Once these are attached, you can then put your overlying grafts or mesh or flaps, or in any way reconstructed device. We spoke about the tensile strength. While it is meant to be flexible in order to take the shape of the rib, it is also solid enough to withstand everyday life and withstand minor trauma in case the patient were to suffer minor trauma, and should be able to conform with his movement, with his daily function, which is something that a rigid patch device will not perform. So in this case, it mimics the shape of the rib, allowing therefore the ribs to move independently of each other. Whereas if we were to use a whole solid structure, that would obviously fix a portion of the chest wall. I cut here using a special device, and that would leave a gap. Underneath the ribs, in here, would be the lungs, and during respiration, the chest wall moves and it generates a negative pressure. So, if the ribs are still missing with this gap in between them, the tissues, the muscle and the skin would be sucked in and out, and that would not allow the lungs to inflate properly. So a rigid structure is needed to bridge the gap in the ribs. Other rigid structures that would involve a patch on the entire chest wall would then hinder the movement of each rib separate to each other, which would also hinder respiration. Therefore, this device is a device that would bridge each rib individually. It will use a ratchet at the end that would be bent to conform to the shape of the rib, to look something like this, with a possibility of putting in a screw for formal fixation. On the other end, there would be a similar such structure, therefore bridging the rib completely. The structure is malleable and therefore will allow it to take up the shape of the rib and will allow it to allow the patient the movements required in his everyday life.